Hello, everyone, and welcome. I'm glad you're here today. We're about to dive into a very important topic, first aid training. This presentation is all about building a safer workplace through essential emergency response skills. Over the next few minutes, we'll cover key first aid techniques, how to respond quickly in emergencies, and how these skills can make a real difference. So let's get started and learn how we can create a safer environment for everyone. Welcome to this training session, which is proudly brought to you by Elion Technologies and Consulting Private Limited. Throughout this course, we aim to share valuable insights and practical knowledge to help you grow and succeed. If you find this training useful and wish to access similar content in the future, I encourage you to visit their website at www.elion.co.in. This resource is available for organizations or individuals looking to expand their skills and understanding. So, let's dive in and see what we can learn together today. Today, we will go through what we'll cover in this session to ensure you have a clear roadmap of our training. First, we'll look at understanding emergency response, focusing on the core principles and the legal frameworks in India, like the Factories Act and the ESI Act, which set important guidelines for workplace safety. Next, we'll explore life-saving techniques such as CPR, how to use an AED, and responding to choking situations, all based on guidelines from the Indian Red Cross. Then we'll discuss common workplace injuries, including burns, cuts, sprains, and typical hazards you might see in Indian industries, so you know how to address them effectively. We'll also cover medical emergencies like heart attacks, strokes, and seizures, how to recognize these critical situations and respond quickly. Finally, we'll focus on building preparedness by developing emergency action plans, assembling emergency kits, and understanding how to make the best use of services like 108 and 102 during an emergency. All these topics are interconnected and vital for ensuring safety and quick response in any workplace situation. Let's talk about why first aid training truly matters. The statistics tell a compelling story. In India, thousands of workplace accidents and injuries happen every year, many of which require immediate medical attention. The crucial point here is that the first few minutes after an injury or medical emergency can make all the difference in the world for the outcome. Research shows that if someone responds with first aid right away, it can reduce recovery time by up to 40%. That's a huge impact. It can also significantly improve survival rates, especially in serious cases like cardiac arrest or severe bleeding. Now, beyond just the health benefits, there's a legal aspect to consider. Under Indian law, including the Factories Act of 1948 and various state-specific rules, employers have a responsibility to provide appropriate medical care at the workplace. This means having trained first aid responders on site, especially when professional medical help isn't immediately available. And let's remember, having trained staff isn't just about compliance. It's about showing your commitment to employee safety. Plus, it can help reduce your liability in emergencies. So, investing in first aid training is really a smart move for any organization. Let's walk through the first step in providing effective first aid. Assess the scene. It's crucial to check for any dangers before you approach the person in need. This means looking out for hazards like traffic, fire, or any unstable objects that could harm you or others. Remember, your safety always comes first. If the scene isn't safe, don't rush in. Wait for professional help or work to address the hazard first. Next, if it's safe to proceed, call for help immediately. You can dial 108 or 102, or activate the emergency response system. Getting professional help on the way is essential. While waiting for them, provide care by applying appropriate first aid techniques. This could involve stopping bleeding, performing CPR, or other necessary steps depending on the situation. Continue to care for the victim until emergency medical services arrive. And always keep in mind, your safety must come first. Never put yourself in danger trying to help someone else. If the scene isn't safe, it's better to wait or address the hazards first before approaching the victim. By following this chain, assess, call, provide care, and wait, you ensure you're helping effectively and safely. CPR, or cardiopulmonary resuscitation, is truly the life-saving skill everyone should know. When someone's heart stops beating, their brain can begin to die within just 4 to 6 minutes without oxygen. That's why effective CPR is so critical. It can actually double or even triple the person's chances of survival by keeping oxygen-rich blood flowing to the brain and vital organs until professional help arrives. Modern CPR emphasizes high-quality chest compressions, ideally at a rate of about 100 to 120 compressions per minute. It's important to press hard and deep, at least 2 inches for adults, to ensure blood flow. And recently, the Indian Resuscitation Council has promoted hands-only CPR, which is especially helpful for bystanders who haven't been trained in rescue breaths. This approach simplifies the process and encourages more people to act quickly. Now the key steps are straightforward. First, check if the person is responsive and breathing. Then, call emergency services, like 108 or 102, and if an AED is available, get it as soon as possible. Next, start chest compressions immediately. Push hard and fast in the center of the chest. Continue until help arrives or the person begins to recover. Remember, quick, confident action can make all the difference in saving a life. Now, let's talk about how simple it is to use an AED. First, you need to turn it on. Just open the device and press the power button. You'll notice that the AED gives clear voice instructions, guiding you through each step without any confusion. Next, apply the pads. Remove any clothing from the person's chest and attach the electrode pads exactly as shown in the diagrams. It's important to place them correctly so the device can analyze the heart rhythm accurately. Once the pads are in place, the AED will analyze the victim's heart. During this time, stand clear and do not touch the person. The device needs to assess the rhythm without interference. If the AED determines a shock is necessary, it will advise you to ensure everyone is clear. Then, press the shock button. After delivering the shock, immediately resume CPR to support the person's circulation. Remember, AEDs are designed to be user-friendly and safe. They guide you with voice prompts every step of the way. You can't harm someone by using one, and the only real mistake is not using it when it's available. This device empowers anyone, regardless of training, to act confidently in an emergency. Let's talk about choking, which is actually the universal distress signal. When someone is severely obstructed in their airway, they can't speak, cough effectively, or breathe properly. One of the key signs to look for is if they are clutching their throat with one or both hands. That's the universal sign of choking. You might also notice them making high-pitched sounds while trying to breathe in, and their face could turn red or even blue, indicating they're struggling to get air. In some cases, they may look panicked or even lose consciousness if the blockage isn't cleared quickly. Now, if you see these signs, immediate action is crucial. First, ask them, "Are you choking?" If they nod but can't speak, that's your cue to act fast. You should start abdominal thrusts, also known as the Heimlich maneuver, right away. Stand behind the person, wrap your arms around their waist, and give firm upward thrusts just above their navel. Continue until the object is expelled or they lose consciousness. Remember, after you've done this, it's vital to get professional medical help immediately. Call emergency services on 108 or 102 without delay. Recognizing these signs and acting swiftly can make all the difference in saving a life. Let's talk about how to control bleeding effectively. The first and most important step is to apply direct pressure. Take a clean cloth or gauze and press firmly right on the wound. Keep applying steady pressure for at least 5 to 10 minutes, and it's crucial not to peek or check too often, as this can disturb the clotting process. Next, if possible and if there's no suspicion of a fracture, elevate the injured limb above the level of the heart. Elevation helps reduce blood flow to the area, which can slow down the bleeding. If you notice blood soaking through the dressing, don't remove it. Instead, add more layers on top and continue applying pressure. This helps maintain the pressure and prevents further bleeding. For severe bleeding that doesn't stop with initial pressure, you can apply pressure to specific points on the artery. These are called pressure points, located between the wound and the heart. Applying pressure here can significantly reduce blood flow to the area. In life-threatening situations, where bleeding cannot be controlled by other methods, using a tourniquet may be necessary. Place it about 2 to 3 inches above the wound, never directly on a joint, and only as a last resort. Remember, safety first. After giving immediate first aid, it's essential to call for professional medical help. In India, dial 108 for emergency services or 102 for an ambulance. Ensuring help is on the way is as important as the first aid itself. Today, let's look at the different degrees of burns and what they mean for the skin and treatment. Starting with first-degree burns, they are the mildest form, causing superficial damage to the outer skin layer. You'll notice these burns are characterized by redness, pain, minor swelling, but importantly, no blisters. They often happen from brief contact with hot surfaces or mild sunburn, which is quite common during Indian summers or when handling hot utensils. For treatment, the key is to cool the burn with running water for about 10 to 20 minutes. Applying aloe vera or a simple moisturizer can help soothe the skin. If needed, cover the area loosely. The good news is that these burns usually heal within a week without leaving scars. Moving on to second-degree burns, they are more serious because the damage extends into the deeper layers of the skin. These burns are characterized by severe pain, deep redness, and the formation of blisters. The skin may look shiny or wet, and swelling can occur. They often result from scalding liquids like hot tea or cooking oil, which are common in Indian kitchens, or from flash burns and prolonged sun exposure. In terms of treatment, immediately cool the burn with water and cover it with a sterile, non-stick dressing. It's crucial not to pop the blisters, as that can lead to infection. For burns larger than 3 inches or involving sensitive areas such as the face, hands, or genitals, seek medical care promptly. It's always better to be cautious. Finally, degree burns are the most severe. They involve full-thickness damage, destroying all layers of the skin. These burns can appear white, black, or even charred. Sometimes, the area may be numb because the nerve endings are damaged. Often, you'll see these burns surrounded by second-degree burns. They are typically caused by serious accidents, including industrial mishaps covered by the Factory Act in India. For these, immediate action is critical. Call emergency services, dial 108 for an ambulance or 102 for emergency help. Cover the burn with a clean, dry cloth, but do not apply water, as that can cause shock. Also, avoid removing clothing stuck to the burn. These injuries require urgent professional medical attention at a specialized burn unit, and hospitalization is often necessary. Understanding these different degrees helps us respond appropriately and seek the right care, which is vital in managing burn injuries effectively. Let's now look at some common workplace injuries in India and how to respond quickly to them. First, cuts and lacerations are quite frequent, especially in industries like manufacturing and construction. The key is to clean the wound thoroughly with soap and water, then apply an antiseptic ointment and cover it with a bandage. If the cut is deep and bleeding doesn't stop after about 10 minutes of applying pressure, it's important to seek medical care. Stitches may be necessary. Next, we have sprains and strains, which often happen due to heavy lifting or repetitive tasks. Remember the rice method. Rest the injured area, ice it for about 20 minutes every 2 to 3 hours, compress with an elastic bandage, and elevate the limb above the heart. If there's severe pain or an inability to put weight on the limb, getting an X-ray is advised. It helps to rule out fractures. Moving on to eye injuries, these are common in industries like construction and chemical processing. For chemicals splashing into the eye, flush immediately with water for 15 to 20 minutes. For foreign objects, don't rub the eye, gently flush, or let tears wash it out. If there's trauma, cover both eyes and seek medical attention right away. Never attempt to remove embedded objects yourself. Always get professional help. Finally, electrical injuries require immediate action. First, turn off the power source before touching the victim. Check if they are breathing and have a pulse, and be ready to start CPR if needed. Call emergency services immediately, either 108 or 102. Remember, even if an electrical injury looks minor, it could cause internal damage, so medical evaluation is essential. That's why adherence to electrical safety standards, as enforced by the Factory Act, is so important to prevent these accidents altogether. Recognizing heart attack symptoms is crucial because every second truly counts. Heart attacks happen when blood flow to part of the heart muscle gets blocked, often by a blood clot. The faster we recognize the signs and respond, the more lives we can save and the less chance of permanent heart damage. The most well-known symptom is chest pain or pressure, which many describe as feeling like an elephant sitting on their chest. But it's important to remember that symptoms can vary quite a bit, especially in women. Women might experience more subtle signs like shortness of breath, nausea, or pain in the back or jaw rather than the classic chest pain. That's why I emphasize the importance of acting FASD if you suspect someone is having a heart attack. Call 108 immediately, which is the emergency helpline here in India. Then, have the person sit down and rest. If they have prescribed nitroglycerin, help them take it. Giving aspirin if they're not allergic can also help by thinning the blood. Stay with them, keep calm, and be ready to perform CPR if they lose consciousness. Now let's talk about the common warning signs. These include chest discomfort or pressure that lasts more than a few minutes, pain radiating to the arms, back, neck, jaw, or stomach, and shortness of breath, whether or not there's chest discomfort. Other signs can be breaking out in a cold sweat, nausea, vomiting, lightheadedness, dizziness, or unusual fatigue. And it's also important to note that women often experience different symptoms, more likely to have shortness of breath, nausea, or pain in the back or jaw rather than the typical chest pain. Recognizing these differences helps us respond promptly and effectively. Let's take a moment to learn how to spot the signs of a stroke using the FASD method. First, F stands for face drooping. If you ask someone to smile and one side of their face droops or feels numb, or if their smile looks uneven or lopsided, that's a serious sign. Next, A is for arm weakness. Have them raise both arms. If one drifts downward or if they feel weakness or numbness in one arm, it could indicate a stroke. S is for speech difficulty. Ask them to repeat a simple phrase. If their speech is slurred, strange, or if they're unable to speak or hard to understand, that's important to recognize. And T stands for time to call 108. If you notice any of these signs, you need to call emergency services immediately and note the time when symptoms started. Remember, a stroke happens when blood flow to the brain is interrupted, either by a clot or bleeding. Brain cells begin dying within minutes, so quick action is crucial. The best treatment is most effective within the first 3 hours of symptoms. Never try to drive a stroke victim yourself. Call emergency services so they can start life-saving treatment on the way and alert the hospital to prepare. Recognizing these signs early can make all the difference. When someone is having a seizure, the most important thing is to stay calm and focused. First, try to time the seizure so you can report how long it lasts. Next, clear the surrounding area of any hard or sharp objects that could cause injury. It's helpful to cushion their head with something soft, like a folded jacket or pillow, to protect them. Turn the person onto their side. This helps keep their airway clear and prevents choking. Stay with them throughout the episode until they are fully conscious again. If the seizure lasts longer than 5 minutes, or if they are injured, or if it's their first seizure, don't hesitate. Call emergency services immediately by dialing 108 or 102. Now, it's equally important to know what not to do. Never hold them down or try to restrain their movements. That can cause injury. Avoid putting anything in their mouth. They cannot swallow their tongue, and putting objects in their mouth can be dangerous. Do not give them water, pills, or food until they are fully alert. And most importantly, never leave them alone during a seizure. Most seizures end naturally within 1 to 2 minutes, and afterwards, the person might be confused, tired, or have a headache. Be reassuring, explain what happened, and stay with them until they recover completely. Remember, staying calm and knowing what to do can make all the difference in protecting someone during a seizure. Now let's look at allergic reactions and how to respond appropriately. First, there's the mild reaction, which might involve localized hives, itching, or mild swelling. Usually, this can be managed with an antihistamine, and just monitoring the person to see if symptoms worsen. Next, we have a moderate reaction. This can include spreading hives, tightness in the throat, or abdominal pain. In these cases, it's important to give an antihistamine and consider seeking medical evaluation to ensure there's no progression. Finally, the most critical is severe anaphylaxis. This is life-threatening and can cause difficulty breathing, swelling of the tongue or throat, a rapid pulse, dizziness, or even loss of consciousness. Recognizing this quickly is vital because prompt action can save lives. If someone is experiencing anaphylaxis, the first step is to call emergency services immediately, dial 108. If they have an epinephrine autoinjector, like an EpiPen, help them use it right away. Inject into the outer thigh, and remember, it can be done through clothing if necessary. Have the person lie down with their legs elevated unless they're vomiting or having trouble breathing. Sometimes, a second dose is needed after 5 to 15 minutes if symptoms don't improve. Even if symptoms seem to improve after the epinephrine, it's crucial to seek emergency medical care because reactions can recur. Quick, decisive action is key to managing allergic reactions effectively. Now, let's talk about heat-related emergencies, which can become serious if not recognized and treated promptly. First, heat cramps are quite common and usually happen after heavy sweating. You might notice painful muscle spasms, often in your legs or abdomen, and typically there's heavy sweating involved. The best approach here is to move to a cooler place, hydrate with water that contains electrolytes, and gently stretch the affected muscles. Most of the time, these cramps resolve with rest and proper hydration. Moving on to heat exhaustion, which is a more serious condition. Symptoms include heavy sweating, weakness, and skin that may feel cold, pale, or clammy. You might also notice a fast but weak pulse, nausea, or even fainting. If someone shows these signs, the priority is to get them to an air-conditioned or shaded area, loosen their clothing, and apply cool, wet cloths to help lower their body temperature. Encourage them to sip water slowly. If they start vomiting or their symptoms worsen, it's critical to call emergency services immediately. Finally, heat stroke is a true medical emergency. It occurs when the body's temperature rises above 103 degrees Fahrenheit. The skin may be hot, red, and dry or damp, and the person might have a rapid, strong pulse, confusion, or even lose consciousness. If you suspect heat stroke, call 108 immediately. While waiting for help, move the person to a cool area and cool them down quickly using whatever methods are available, like a cool water bath, wet sheets, or ice packs applied to the armpits, groin, and neck. Importantly, do not give fluids in this situation, as it's a life-threatening emergency that requires urgent medical attention. Recognizing these signs early can make all the difference. Now, let's take a closer look at building your workplace emergency action plan in India. First, written procedures and compliance are essential. You need to document clear steps for various emergencies, making sure they align with the Factories Act of 1948 and other relevant laws. This includes procedures for medical incidents, fires, natural disasters like floods or earthquakes, and security threats. It's important to specify evacuation routes, assembly points, and emergency contact numbers, such as 108 for medical emergencies and 102 for fire or police. Remember, these procedures should be reviewed and updated annually to stay compliant and effective. Next, assigning roles and responsibilities is crucial. Designate trained first aid responders, evacuation coordinators, and emergency contacts, ensuring there are enough personnel trained for each role to cover absences or shift changes. Clearly display these roles and contact details throughout the workplace, including information about the local hospital. Regular training and drills are the backbone of preparedness. Conduct emergency drills at least twice a year, as mandated by safety regulations. Review first aid procedures quarterly, maybe with guidance from organizations like the Indian Red Cross Society. Provide refresher training for responders annually, so skills stay sharp. Also, ensure new employees receive comprehensive emergency training during onboarding, covering both site-specific protocols and general safety measures. Finally, a robust communication system is vital. Establish clear methods to alert everyone during an emergency, whether through PA announcements, sirens, or SMS alerts. Keep contact lists up to date for all staff and their emergency contacts. Create protocols for notifying families if a serious incident occurs. And don't forget to regularly test these communication systems, making sure all employees understand how to receive and respond to emergency alerts. By integrating these elements, well-documented procedures, defined roles, ongoing training, and reliable communication, you're creating a strong foundation for workplace safety and emergency readiness. Now, let's take a closer look at the essential contents of a first aid kit. First, we have the basic supplies. These include adhesive bandages of various sizes to cover small cuts and grazes, sterile gauze pads in 4x4 and 2x2 sizes for larger wounds, and adhesive tape to secure dressings. Elastic bandages are also important for sprains, along with triangular bandages that can be used as slings or for general support. Scissors and tweezers are necessary tools for removing debris or cutting bandages. Disposable gloves, preferably non-latex, help maintain hygiene and protect both the responder and the injured person. A CPR face shield is vital for providing mouth-to-mouth resuscitation safely. Instant cold packs can reduce swelling, while a thermometer helps monitor body temperature. Moving on to medications and ointments. It's important to have antibiotic ointment for preventing infection, antiseptic wipes for cleaning wounds, hydrocortisone cream for allergic reactions, and basic pain relievers like aspirin, paracetamol, or ibuprofen. An antihistamine is useful for allergic reactions, burn gel for burns, and eye wash solution to rinse out foreign particles or chemicals. Now, let's talk about reference materials. A first aid manual based on Indian guidelines is essential for quick reference. Emergency contact numbers, such as 108 or 102 for ambulance services and local police, should be clearly visible. Additionally, maintaining a list of employee medical conditions or allergies, done with their permission, can be crucial in emergencies. It's important to remember that the Factories Act of 1948 and other Indian labor laws require every workplace to provide and maintain adequate first aid facilities. This means having at least one well-stocked first aid box for every 150 workers. Larger facilities, or those handling hazardous operations, need more kits, as recommended by DGFASLI guidelines. Ensure these kits are placed in easily accessible locations, known to all employees. Regular checks and monthly restocking are vital. Any expired items must be replaced immediately to ensure readiness. This preparation helps us handle common workplace incidents efficiently, whether it's minor injuries, cuts, burns, or heat-related health issues. Let's now look at some important documentation and legal considerations in India when it comes to workplace safety. First, incident reports are crucial. It's essential to document all workplace injuries immediately. This includes recording details like the date, time, location, who was involved, a description of what happened, the treatment provided, and the outcome. Keeping accurate records not only helps us stay compliant with Indian labor laws, such as the Factories Act of 1948 and relevant state rules, but also is vital if there are any workers' compensation claims down the line. Next, let's talk about the Good Samaritan guidelines. In India, the Supreme Court has set guidelines that protect individuals who voluntarily provide emergency medical assistance to accident victims. This legal protection encourages people to help quickly without the fear of harassment or legal repercussions, as long as they act in good faith and without gross negligence. It's an important safeguard that promotes timely aid. Moving on to privacy and consent, these are fundamental. Always seek informed consent before providing care to a conscious adult. If someone is unconscious or unable to respond, implied consent is assumed. Respecting patient privacy is critical. Medical information should only be shared with authorized persons and in accordance with data protection principles. Lastly, encouraging employees to share their medical information confidentially with HR can be life-saving during emergencies. Knowing about serious medical conditions, allergies, or medications allows for better, more tailored emergency responses. Promoting the use of medical alert tags for those with life-threatening conditions is also a good practice to ensure swift and appropriate care. All these points tie back to our overall goal: creating a safe, compliant, and caring workplace environment. Now, let's talk about maintaining your skills and certification over time. First, your initial certification is key. You should complete a comprehensive first aid and CPR course from a recognized provider, such as the Indian Red Cross Society, St. John Ambulance India, or other accredited Indian organizations. Remember, hands-on practice is essential. Online-only courses often don't provide the practical experience needed to respond confidently in emergencies. After your initial certification, most certifications are valid for 2 years. It's important to schedule your recertification before it expires. Doing so helps you keep your skills sharp and ensures you're up to date with any new protocols or techniques, especially those relevant to our Indian context. Even between recertifications, I recommend reviewing procedures annually. Practice CPR on a mannequin, revisit your emergency action plans, and stay informed about any new first aid recommendations that may be applicable here in India. This continuous refresh keeps your response readiness at its best. Finally, ongoing education is vital. Attend workplace safety meetings, review relevant case studies, and learn from actual emergency responses. If possible, consider advanced training in specialized areas, like industrial first aid or medical care tailored to common regional health issues. These steps help us stay prepared to protect ourselves and those around us in any situation. You have the power to save lives, and that's the core message of today. Let's go over some key takeaways. First and foremost, scene safety comes first. Always protect yourself before helping others. Your safety is the top priority because only then can you effectively assist someone in need. If you're faced with a serious emergency, remember to call 108 or 102 immediately while providing care. Prompt action can make a huge difference. High-quality CPR and early use of an AED are critical. They dramatically improve survival rates when performed quickly and correctly. Recognizing the signs of heart attacks and strokes early is vital. Quick identification can save lives and also prevent long-term disabilities. It's important that your workplace has a comprehensive emergency action plan along with well-stocked first aid kits, as mandated by the Factories Act or relevant state labor laws. Being prepared in advance can make all the difference. Regular training and practice are essential. They help you maintain the skills needed to act confidently in an emergency. Remember, the willingness to act is what truly separates bystanders from lifesavers. You don't need to be perfect. You just need to try. Taking even imperfect action can be the life-saving step someone needs. Your intervention could mean the difference between life and death for a colleague, a friend, or a family member. So always be ready to step in. If you have questions or need more resources, reach out to your safety officer or HR department. They can provide additional training or help report safety concerns, all while keeping in mind the Indian labor regulations. Ultimately, it's about empowering each of us to act. Because when we do, we can save lives and make our workplace safer for everyone.